good morning, everyone. It is so lovely to having you here today. We are going to talk about Sophi and its distinct features and advantages. We have a lovely pair of speakers here, Dr. Caparas and Dr. De Guia from Philippines. So I'm your host today. I am Dr. Başak Bostancı from Turkey, Istanbul. And I would like to give the word to Dr. Caparas first to give his talk. Thank you very much.
Thank you, Doctor. Okay, good morning, everybody. I'm Vic Caparas of the Medical City Eye and Vision Institute in Manila, Philippines. Thank you very much for coming. I'm here today to present some initial evidence on how well the Sophi system can remove a cataract and if it can do it safely. Let's revisit what Sophi claims. Sophi is built around a design principle most systems don't use. Aspiration removes material. A separate system maintains pressure. The net efficiency gained is clinically felt. There is faster quadrant removal in dense lenses, less pedal micromanagement, and lower cognitive workload during difficult cases. The bottom line is that Sophi allows efficiency to be driven by technique and not limited by fear of instability. The benefit is readily seen from this video, which shows a stable chamber and no trampolining of the capsule, despite being a challenging patient who squeezes, whose eyes are rolling everywhere, and who's moving his head everywhere. Most Phaco complications do not occur during steady state aspiration. They occur during rapid pressure transitions. Sophi actively controls occlusion and occlusion brake control. And as you can see from the video clip, the clinical effect of this is a more stable posterior capsule position, a safer high vacuum fragment engagement, and fewer snap events during dense cataract removal. Sophi protects the endothelium by controlling fragment engagement time. The benefit is seen especially in our dense Asian cataracts by lower EPT for equivalent work and more predictable timing for prophylactic OVD recoating. Sophi enables safety during the most dangerous moments. This results in fewer case interruptions, safer topical anesthesia surgery, and reduced stress for surgeons and the OR team. So clearly, these are great innovations. However, let me bring up one important point. Surgeons don't reject new Phaco machines because they aren't impressive. Most surgeons who hesitate are not anti-technology. They are anti-risk. They hesitate because they are responsible for costs, for staff, for sustainability, and most important, for outcomes. You don't sell a Phaco machine by proving it's better. You help surgeons first feel that it's safe. And you help surgeons feel safe by showing evidence of that. Because without evidence, adoption is merely emotional, and decisions are reversible, and support becomes defensive. We define efficacy as the capacity to perform phacoemulsification to remove a cataract. One metric is to measure the amount of energy expended in doing so. Sophi uses EPT, or effective phaco time, measured in seconds, while other standard torsional machines use CDE, or cumulative dissipated energy, measured in joules. These are prominently displayed in both machines. To measure safety, we limited our observations to the amount of potential damage to the cornea during phaco as measured by endothelial cell counts, pachymetry, and the proportion of six-sided or hexagonal cells in the cornea. All three metrics track corneal health and are potentially affected by the introduction of ultrasonic energy into the anterior chamber. Our initial study comprised 10 patients and 20 eyes. On one eye, we performed phaco with the Sophi machine and on the other with a standard torsional phaco machine. We recorded the EPT and CDE for each eye and converted the CDE to EPT. For the safety part of the study, we measured corneal metrics, again, the endothelial cell counts, the pachymetry, and the cell hexagonality. So this is an initial study, and we are continuing to do this study with the purpose of publication. The descriptive statistics of our patients are shown here, and they show no significant differences between the Sophi and the torsional population. The first question we tried to answer is, does the Sophi perform phacoemulsification as well as what we are used to? To establish efficacy, we plan to compare the amount of energy expended by the Sophi and torsional phaco machines. But to do that, we would have to compare to similar but slightly different metrics, EPT versus CDE. While EPT focuses on efficiency of ultrasound usage, CDE reflects overall energy exposure to ocular tissues. It is important to state that conversion of CDE to EPT is not straightforward and at best is an estimate. For example, increased power to emulsify a hard cataract does not proceed in a linear fashion. It is a curved accelerating relationship called the power law curve. The formula shown here reflects that curve and is our best estimate in comparing apples to apples. So, what did we find? In the 10 patients in our series, comparing Sophi EPT measured in the surgery of one eye to the converted torsional EPT in the contralateral eye, we found no significant statistical difference. So this implies non-superiority of our former standard torsional phaco machine compared to the Sophi. The second question we sought to answer was, is it safe to use as what we are used to, using corneal health parameters again, the cell count, the pachymetry, and the hexagonality? First, we measured corneal parameters preoperatively and found no significant differences between the intended Sophi and torsional eyes. We then measured the same parameters, comparing Sophi pre-op to Sophi post-op, and the same for torsional. The result is that we did not find any significant changes in endothelial cell counts in both the Sophi and torsional groups, pre-op and post-op. So what does it show? It implies that the surgeries performed, whether using the Sophi or torsional machines, did not cause significant changes in the corneal parameters being observed. This speaks to the safety of both. And in this slide, we show no significant changes in pachymetry and no significant changes in the six-sidedness of the cells. So now we compare the percent change in endothelial cell counts induced in the Sophi eye and the torsional eye of the same patient. We found again no significant difference post-operatively in endothelial cell counts between the Sophi and torsional eyes. The same for pachymetry and the same for cell hexagonality. Obviously, there are limitations in this pilot study that we intend to correct in our more comprehensive study. We intend to further refine the comparability of EPT and CDE, considering factors of each machine. The observation period will be expanded to track any further changes in the corneal metrics using more precise instrumentation, and with increased familiarity with the Sophi approaching that of the current standard torsional machine, this will make our comparisons more robust. So in conclusion, when compared with our current standard torsional system, the Sophi phaco system did not cause significantly more changes in corneal health metrics. Neither was there any difference in how much energy was expended in removing cataracts. Given this, we can state with good evidence that the Sophi phaco system is no less safe and efficient than our current standard system. Thank you very much.
Thank you, Dr. Caparas. That was an amazing talk. And although I'm a Sophi user, I learned a lot from your study. So I will have some questions after. And now I would like to give the word to Dr. Abbey De Guia.
Good morning, everybody. Thank you for stopping by. I am going to spend the next few minutes talking about the Sophi Phaco system, focusing on two very practical ideas, a little bit less technical than what we just heard from Dr. Caparas, because I think he covered very well all of the technical aspects of it. So I will look at the simplicity and sustainability, and later on talking a little bit more about the next generation of phaco surgeons, our residents. So to start off, we look at the interface and the human factors of the Sophi. Its simplicity is designed around the operating room and not around the cables. So we know that it is a cable-free machine with a wireless foot pedal. And why is this so important? It makes the OR feel less cluttered. It makes it feel like instead of focusing on what's around you, it really focuses instead on the surgery itself, on the surgeon, on you, and on the patient. It has a monobrake system, which is important for our OR staff, important for our nurses. Moving that setup around, whether it's the right eye or the left eye, it really makes ease of use a lot better. It's battery powered, so we don't have to, again, worry about the cables, worried about whether it will shut down in the middle. Battery can last the entire day, and we have tried and tested that in our operating room. And for the Sophi A, which is very small, compact, it's very easy, transportable, place it in the back of a moving van and bring it to your next destination. So what are the technical takeaways of it being so simple in its design and in its human interface? There's reduced setup steps, which makes it easier to control, easier to focus on your surgery. There's less OR clutter, which makes it easier to move forward to the next steps, not just for the surgeons, but for the staff as well. And there is faster room readiness. So turnover time, especially in high volume centers, eye centers, you really get a sense that you can have as many cases throughout the day. Let's look now at the workflow design, the ease of use of how the machine operates. It reduces in its entirely cognitive load. It's intuitive in terms of its graphical user interface. It has very clear visual status indicators, and the layout of the controls are very logistically done, so there's really less that you have to worry about. And it has multi-surgeon profiles like the other machines, so there's no thinking about how to input your settings, how to input what you want to use for your surgery for the day. Everything is very intuitive. And takeaways from this, there's less reliance on memorization, there's faster orientation for new users, and there's a consistent experience across cases. So what are the training benefits of simple system? And we focus on this because at our institution, at the Eye and Vision Institute at the Medical City, we deal with residents. And of course, what is important when it comes to dealing with residents? There's fewer setup variables, there's less setup related stress, not just from our end, but on their end. There's clear feedback, and there's a very predictable behavior of the machine when you're doing your surgeries itself. And so what is the role of Sophi in resident training? And I think this may be the first time this is talked about in any setting. We find that there is a shorter learning curve for setup. There is reduced dependence on staff intervention, and it allows focus on surgical fundamentals, which is very important when you're a first-time surgeon. And I'll demonstrate this over to this first video. This is a video of one of our early Phaco users. I think this was her 6th or 7th case, less than 10 cases that she's done. And she was using a different system, moved over to the Sophi system for this case. And you can see that I had talked to her about this afterwards. She said she was very comfortable using the Sophi. She said that the anterior chamber was stable all throughout. She was able to do a quick chop. You can see her make a groove dive here with the Phaco machine, with her Phaco probe. And she's able to perform that crack very beautifully. She was very, very comfortable using it. And what she noted was the foot switch or the foot pedal was very, very easy for her to use. So you can see her, she's able to get a good grasp on the basics. As I was instructing her during this case, there was no problem for her switching to the system from the earlier one. it's a very also, yes, so Dr. Caparas said it was a hard cataract, and she performed this in actually only about 20 minutes. So very good for someone who's done less than 10 cases. Second video I have here is also of another resident, and this is also less than 10 cases that he's performed. This time he used a different technique. He created a little bit of a groove. And you can see here that, again, it's a little bit of a hard cataracts. We're used to hard cataracts in the Philippines. And for someone who's only performed less than 10 cases, and the first time with this machine, you can see that the shift was very seamless. His big takeaway here is this surgeon was actually having a difficult time with our other Phaco machine. He noted that there was difficulty in terms of the foot pedal. It was too smooth for him. But in terms of training, this surgeon actually said that he enjoyed the feedback, that a little bit of a clicking system of the foot pedal that the Sophi provides. And it said it was able to give him tactile feedback to know whether he was at step 1, step 2, step 3. And so I think that this is a very good thing that the Sophi provides for our beginning surgeons. So you can see here, he had a little bit more difficulty than the first surgeon, but he was able to complete it in about 30 minutes. Very good for a first-timer Phaco surgeon. So what I wanted to highlight in all of my slides is that the simplicity really does extend beyond surgery of the Phaco. And we talk about extending beyond surgery by looking at sustainability. And if it's something that we as surgeons are not yet looking into, we should. And I know that it's a big priority here in some of our other centers, but it should be something that moving forward we look into. And the Sophi was really designed to have less waste. Its lean cassette concept allows for 10 cases a day. It has fewer disposable components, and there's reduced plastic and packaging. We noted that there was a 75% reduction in plastic waste by waste, and about a 65 to 70% reduction in packaging and storage volume. There is also a very big cost and efficiency impact. There is lower consumable use, reduced storage requirements, and time savings across multiple cases, which is very important for high volume centers. 17% reduction was noted in consumable costs. And you might think that this is a small amount, but in the long run, cost really adds up, savings really add up. And so in conclusion, Sophi is simple and sustainable, and from personal experience, it is a revolutionary way to do Phaco. Thank you very much. Turn you back over to Dr. Başak.
Thank you so much, Abbey. So it was wonderful to hear from you about the sustainability advantages, and also seeing how residents, the beginners for cataract surgery, did how well with the Sophi machine. Was amazing. Yeah, I didn't think about it that way. When you are teaching, it is amazing how new advantages in technology help our beginners, how they, feel confident when they're doing cataract surgery. It was wonderful. Thank you very much. So please allow me to ask you a question. So you showed us beautiful cases, but I bet you have very, very, complex cases. And Sophi machine is known for its active IOP control and a very stable anterior chamber. In your complex cases with a restless cataract patient, a dense cataract, how does Sophi Phaco system help you to deal with those cases?
Thank you very much for the question. Yes, we do have many restless patients, and these restless patients roll their eyes, they squeeze, and every time they squeeze, the IOP increases, and you see the chamber shallowing or the posterior capsule coming up, becoming more convex. And so the value of Sophi is because it has a dedicated pump that keeps the IOP in the eye steady and stable, so that you can concentrate on doing what you need to do to remove the cataract and leave the stability and the depth of the chamber stable. And that helps any surgeon, expert or beginner, to do what he needs to do safely and efficiently.
And Abbey, I would like to ask you a question regarding the 75% lower consumables that you mentioned. I don't want to sound mean. It is, of course, very important for the environment to have less plastic. But if you would translate it to economics of a clinic, it also means something else, right?
So a 75% reduction always translates to cost. And I think that we would be ignorant to think that cost, especially in high volume centers, isn't important, isn't something that we need to look into. Because when we talk about reduction in cost, reduction in all of these disposable materials, we don't just look at the waste that comes afterwards. We look at setup, we look at the workflow, we look at turnover time. And so 75% isn't just in terms of waste, it also translates to OR setup, it translates to time lost. And I think that is the key thing that most people don't think about. Your 1 hour can easily shift to a 30 minutes, and that's easily another case. So in one day, you double immediately how many patients you're able to see, how many patients you're able to treat.
Any question from the audience? I have more questions, so I'm happy to ask my questions. So, Dr. Caparas, you talked about the triple pump system. So this triple pump system, does this help you with the fluidics? Because sometimes we have so many changes in the fluidics during a case and you have to change everything. And does it make things very easy for you?
Well, the Sophi has 3 pumps. It has a peristaltic, it has a venturi, and it has a dedicated pump just to keep the IOP steady. And that's a real advantage. Now, whether you're a peristaltic surgeon or a venturi surgeon, the other pump just takes away all the other guessing. Now, it's very interesting for you to ask because last night I was talking with Dr. Ben Lahoud, and he was saying that when he analyzed what he was doing and why he felt safer with his old machine, the torsional, he found out that he was keeping it steady by feathering the pedal. So he was controlling it with the pedal. Okay, so when it was a hard cataract, he would be even more careful. When it was an easy cataract, he could let it rip. Okay, but the thing is, with the Sophi, that takes out all the calculations. You don't have to think about that. You have now just to think about how much vacuum I need. If it's a very dense cataract, I can pump up the vacuum, keep the fragment at the tip, and then just burst it out. And you don't have to worry about the chamber shallowing or the capsule coming up. And that's the value of this, whether you're a venturi or a peristaltic patient.
Thank you. And perhaps my last question to you, Abbey. I loved how you described Sophi. So it is around the OR, not around cables, because I hate cables, and the nurses and the OR team, everybody hates cables. When you are moving the patient, cables are in the way. Yes. When you're trying to walk between cases, there is always a cable to look for. So what do you think, not aesthetically, but, physiologically, how does, Sophi make things much easier for you in the OR?
I will talk about a practical, actually not an actual event that happened in our operating room. And this isn't a one-off. This has happened several times where we are operating and suddenly, out of nowhere, the machine turns off. Out of nowhere, our Phaco probe stops working and we're looking around wondering what happened. And we noticed the machine turned off. One of the nurses passed by, one of the trainees, an intern or clerk accidentally tripped on the machine on wires. And suddenly everything is thrown off. And it's not just about safety for the patient. It's also about your flow as a cataract surgeon. And so we noticed that with the Sophi, which is dedicated to one of our operating rooms, it never happens. And it makes you feel safer as someone who's even just watching the surgery. To go around, to see how the setup works, to watch the cataract surgeon working. It makes the nurses a little bit less worried about what will happen to the machine because it is also up to them to set it up again. And so I think in terms of how the OR works, it's safety not just as a surgeon, but it feels more comfortable. There's also a little bit of moving the machines around to the different operating rooms depending on what's happening. And we noticed that the nurses, bring the things with them. They bring the machine and they're able to transfer to different ORs with no problems, no setup, no priming required again. And so I think that if you have a center that has not a lot of space or a center that has multiple operating rooms, this is really something that you can benefit from.
Why don't you mention, Abby, the survey we ran on our OR staff?
So we conducted at our center a survey on the use of Sophi. We've had it for less than a year, and we had consultants and nurses answer the survey. Our consultants talked a lot about how the fluidics worked and the foot switch and all of that. But the nurses, the focus that they really brought out in our survey was how easy it was in comparison to our other Phaco machines. They talked about once that learning curve of learning how to set up the machine was passed, it was very, very easy. And they actually, in one of the comments, it noted how it was easy to transfer the machine from the left side to the right side when dealing with right or left Phacos, which is something that in our other operating rooms we weren't able to do because the machine is really fixed, it's plugged in, we can't just move it around as easily. And so it's actually the nurses who had a very easy time using it. And it's something we as surgeons don't really think about. We don't think about OR setup all too much, but when focusing on what they are responding to, our staff, our support staff, who I think are just as important for our surgeries.
Yeah, I always say happy nurses, happy life. Thank you for being with us. It was wonderful. And we learned a lot from both of you. And hope you also learned with us. And hope you have a wonderful APAO. See you.
Thank you. Thank you.